Hi guys, this is David Villar, and in this short video I'm going to present the case of a dog that was hit by a car and needs orthopedic surgery. And I can tell you up front that orthopedic cases are the most painful conditions that any animal can experience, so we have to provide the best analgesia available. And so whatever you read for other types of surgeries like ovariohysterectomies or castrations or any other elective surgeries is probably not going to provide enough analgesia here. So this is the case of a 8-month-old 10-kilogram spayed Labrador retriever. He's presented with severe lameness in the pelvic left limb with a history of being hit by a car the day before. On physical exam, he's depressed but responsive. He has a rectal temperature of 104 degrees, 130 beats per minute, 36 for respiratory rate, a body score of 5 out of 9. For pain assessment, according to the Glasgow composite scale of 8 out of 24, and we can tell there is a huge hematoma and edema in the distal region around the left femur, and they could tell there was a clear fracture when they palpated that femur. Now if we look at the radiograph, they could notice there was a complete fracture on that distal part of the femur, with a few bone fragments surrounding that fracture. And there was a lot of soft tissue swollen around that area. Fortunately, there was no tissue gas, which would suggest an open wound. So the sooner they would perform surgery, the better chances that animal would restore that normal function. They did a complete blood workup and everything was within the normal limits, which means that that animal didn't really have any underlying conditions to prevent the surgical procedure, and should be able to handle the anesthesia without any complications. So here we have a set of questions for this case, and the idea is for you to come up with a game plan for the pre-anesthetic phase, during the anesthesia, and the post-operative period. I think you can probably answer most of them. We are here to help you. I think if you have already watched the videos, you'll probably be able to manage most of these questions. If not, you can probably do your own literature search. As you can see, the questions are: state the main clinical problems that this dog has based upon the information you now have. Determine that the dog needs surgery under general anesthesia. So name 2 drugs you could use as good pre-anesthetics for this dog, and what would you pursue to achieve with each one. Conduct a brief Pac-Man analysis for each one. Name at least 2 drugs you would use to induce anesthesia, and how would you administer them to avoid overdose in the animal. Again, use Pac-Man to analyze. Suggest and defend your choices of a maintenance anesthetic drug. And after successfully bringing the dog through surgery, choose the appropriate drugs for management of pain during the post-operative period, and conduct a Pac-Man analysis. And if you didn't select any of the previous choices for the post-operative period, explain why. So again, let us know how you get on with these questions, and good luck. And so take care, guys, and bye bye for now.